Chiropractic is the only profession that is addressing this. We're looking at the spine, we're looking for misalignments, what are known as a vertebral subluxation. It often happens most commonly in the upper neck due to the unique anatomy and unique stressors that we're under, which will, by the nature of the anatomy there, necessarily affect the nervous system. The spinal cord is traveling through there. The blood supply is traveling through this region. The cerebrospinal fluid, which nourishes the brain, and the spinal cord is traveling through this delicate area.
And we have seen so many changes in Liam since he's been coming. He went from having up to 60 seizures a day till the last month and a half, almost 2 months, he has been basically seizure-free.
We know that subluxation causes negative neuroplastic changes through disafferentation. It changes the information getting to the brain. It can affect the brainstem and or brain blood flow and the cerebrospinal fluid flow. There's 3 types of stress, okay? This is how we kind of break it down. Physical stress, trauma, okay? What would be some traumas that can occur to both a child and an adult? Falls. How many times do kids fall? Falls off beds, falls off cribs. The birth process actually is one of the most common traumas. Now we're seeing what we've been talking about, what we've known, that chiropractic is changing the brain. It changes the way the brain is functioning.
We've seen a lot of improvement in him, a lot through his speech. His vocabulary has grown vastly. He's using a lot more words. I'm able to have more conversations with him.
How common do you think subluxations or these misalignments of the spine are? Yeah, they're very common. All systems that are made of parts are eventually designed to break down. And so subluxation is a very natural part of our existence. Chiropractic recognized that this is occurring 120 years ago and began a process of addressing this. For some individuals, the subluxation can be huge, depending upon how it's impacting the nervous system and how long it's been there. If it started at birth, or later on, or to what degree. Or for other individuals, it's kind of like a dimmer switch. Because sometimes we don't know what we don't know. We don't know that our life is being impacted by our nervous system not at its optimal because we're so used to experiencing life over here. One study had 1,000 infants were checked in the first month of life. 80% were found to have a misalignment of the upper neck. Another study, 1,250, 90% had suffered birth trauma, 10% was more severe. So birth trauma is actually quite common. This medical doctor said the birth process, even under the best conditions, is potentially a traumatic event for the fetus. Spinal cord and brainstem injuries often occur during the process of birth but frequently escape diagnosis. So why is it escaping diagnosis? Why are we not recognizing this? who's looking for this, who's recognizing the signs. The most common signs include colic, failure to thrive, inability to breastfeed, ear infections, chronic immune system issues. I do these talks because I know how many other Nicholases are out there, how many other children, your children, that we need to find out, how this can help. And not just for your children, but also for yourselves. I believe that everyone should have their spine and nervous system checked throughout a lifetime, sort of like going to the dentist.